Ever wondered why glucose disorders occur? Glucose, a simple sugar, plays a vital role in our health. But when things go wrong, it can lead to a range of disorders that pose significant challenges in the world of medicine. From diabetes to hypoglycemia, glucose disorders impact millions of lives globally every day. Understanding these conditions is not just essential for healthcare professionals, but also for anyone interested in maintaining optimal health. So, are you ready for a deep dive? Stay tuned as we delve into the fascinating world of glucose disorders. Understanding glucose disorders begins with a look at what glucose is. Glucose, often referred to as blood sugar, is a type of sugar that is the primary source of energy for our body's cells. It's like the fuel that keeps our body's engine running. Glucose is created when our body breaks down the carbohydrates we eat. Once produced, it's carried by our bloodstream to all the cells in our body. Now let's talk about the role glucose plays. You can think of glucose as the VIP guest at a party. The cells in our body are the partygoers, and insulin, a hormone produced by the pancreas, is the bouncer. Insulin's role is to let glucose into the cells where it can be used for energy. Without insulin, glucose can't get in, and the cells can't function properly. Normal glucose levels vary throughout the day. Typically, they're lowest in the morning before we eat and rise after meals. A healthy fasting glucose level, that's the level before you eat, is usually between 70 and 100 milligrams per deciliter. 2 hours after you eat, it should be less than 140 milligrams per deciliter. But when these levels become abnormal, we start to see glucose disorders. If your body doesn't produce enough insulin, or if the cells resist insulin's efforts to let glucose in, glucose levels in the blood can get too high. This is known as hyperglycemia. On the other hand, if glucose levels drop too low, we have hypoglycemia. Both conditions can be dangerous if not managed properly. Glucose disorders are like a party gone wrong. Imagine if the bouncer insulin doesn't show up, or if the VIP guest glucose arrives in overwhelming numbers or doesn't come at all. The party, or in this case your body, doesn't function as it should. Now that we have a grip on what glucose is, let's explore the types of glucose disorders. The most common glucose disorder you might have heard of is diabetes. A household name, isn't it? But what is it exactly? Well, there are mainly two types, type 1 and type 2. Diving into type 1 diabetes, it's an autoimmune disorder. Your own immune system mistakenly attacks and destroys insulin-producing cells in the pancreas. Thus, your body can't produce insulin, a hormone that regulates the level of glucose in your blood. The onset of type 1 diabetes is often sudden and dramatic, with symptoms like excessive thirst, frequent urination, unexplained weight loss, and fatigue. Switching gears to type 2 diabetes, it's a different ballgame. Here, your body can still produce insulin, but it either doesn't make enough or your cells become resistant to it. This results in sugar buildup in your bloodstream. Type 2 diabetes tends to develop more gradually, and its symptoms might be less noticeable. They include the same symptoms as type 1 but also slow-healing sores, frequent infections, and areas of darkened skin. Now you might be wondering, how common is diabetes? The answer is, incredibly common. In fact, according to the World Health Organization, about 400 million people worldwide had diabetes in 2024, and the majority of these cases were type 2. That's roughly the equivalent of the entire population of South America. But why is it so prevalent? There's no one-size-fits-all answer, but factors like obesity, lack of physical activity, poor diet, and genetic predisposition play significant roles. Furthermore, our modern lifestyle, with its fast food and desk jobs, is a major culprit in the rise of this disorder. However, it's important to note that diabetes is not an inevitable fate. There are several preventive measures that can be taken, such as maintaining a healthy weight, eating a balanced diet, and getting regular exercise. Diabetes, despite being common, is just one type of glucose disorder. There are other glucose disorders as well, which we will delve into in the following scenes. So, stay tuned folks, this is just the tip of the iceberg. Another glucose disorder that affects many is hypoglycemia. Let's take a moment to delve into the world of hypoglycemia, a condition that's often misunderstood and overshadowed by its more notorious counterpart, diabetes. Hypoglycemia, in simple terms, is a condition characterized by abnormally low levels of glucose in your blood. This is the opposite of diabetes, where there's too much glucose in the blood. So, what causes hypoglycemia? It could be attributed to several factors. It might be due to medications, especially those used for treating diabetes. It could also be the result of certain illnesses, hormonal deficiencies, or even prolonged fasting. Everybody's body is unique, and so is the way it reacts to changes in blood glucose levels. Now, onto the symptoms. These can vary from person to person, but they often include feelings of weakness, dizziness, sweating, and a rapid heartbeat. Some people may even experience confusion or difficulty concentrating. It's crucial to recognize these signs as early as possible because if left untreated, hypoglycemia can lead to serious problems, including seizures and loss of consciousness. In contrast, diabetes is characterized by high blood glucose levels, often due to the body's inability to produce enough insulin or use it effectively. The symptoms can be quite different as well, including increased thirst and urination, unexplained weight loss, and fatigue. But here's the kicker. While they seem like two sides of the same coin, hypoglycemia and diabetes are not mutually exclusive. In fact, hypoglycemia can often occur in people with diabetes if their blood glucose levels drop too low, usually as a result of taking too much insulin or not eating enough. So while they're different conditions, they share a common thread: the delicate balance of glucose in our bodies. It's this balance that keeps us going, powering every cell and every thought. While hypoglycemia and diabetes are common, there are other glucose disorders that are less known but equally important. Beyond diabetes and hypoglycemia, other glucose disorders exist. These disorders, although not as well known, play a significant role in the health and well-being of people around the globe. Let's delve into a couple of these lesser-known glucose disorders: gestational diabetes and impaired glucose tolerance. First off, let's talk about gestational diabetes. This is a condition that only affects pregnant women. It's characterized by high blood sugar levels that develop during pregnancy in women who didn't have diabetes before becoming pregnant. The real kicker here is that while gestational diabetes usually goes away after the baby is born, it does increase the mother's risk of developing type 2 diabetes later in life. The second disorder we're going to discuss is impaired glucose tolerance, also known as prediabetes. This is a condition where the body's response to glucose is not normal, but not abnormal enough to be classified as diabetes. People with impaired glucose tolerance have blood sugar levels that are higher than normal, but not high enough to be diagnosed with diabetes. It's like being stuck in a no-man's land of glucose disorders. The tricky part about impaired glucose tolerance is that it often doesn't show any symptoms. It's like a stealthy ninja, silently increasing your risk of developing type 2 diabetes and heart disease. So, if you're at risk, regular checkups are your best defense against this sneaky disorder. In the grand scheme of things, these disorders may seem less common compared to their more famous counterparts, diabetes and hypoglycemia. However, they are no less important. They can significantly impact a person's quality of life and may lead to other serious health complications if left untreated. So, remember, when it comes to glucose disorders, it's not just about diabetes and hypoglycemia. There's a whole spectrum of disorders out there, each with its unique challenges and implications. These disorders, while less common, impact the lives of many people worldwide. So, let's continue to shed light on these conditions, raising awareness and understanding, one glucose molecule at a time. So, what causes these glucose disorders? It's a question that's been asked by many, and while there's not one simple answer, there are several key factors that play a role. First up, we have genetic factors. Our genes, those microscopic bits of DNA that dictate everything from our eye color to our height, can also influence our risk of developing glucose disorders. Certain genetic mutations can affect the body's ability to produce or respond to insulin, the hormone that regulates blood sugar levels. If you have a family history of glucose disorders, your risk may be higher. Next on the list, we have lifestyle factors. This includes things like diet and physical activity. Consuming a diet high in sugars and saturated fats, for instance, can lead to weight gain and increase your risk of insulin resistance, a condition where the body doesn't respond properly to insulin. On the flip side, regular physical activity can help maintain a healthy weight and improve insulin sensitivity. But it's not just our genes and lifestyle that can cause glucose disorders. Other medical conditions can also play a part. Conditions such as polycystic ovary syndrome or PCOS can lead to insulin resistance. Similarly, conditions that affect the pancreas, the organ that produces insulin, can lead to glucose disorders. This includes conditions like pancreatitis and pancreatic cancer. Certain medications can also affect blood sugar levels. Steroids, for example, can increase blood sugar levels, while certain types of diuretics can decrease blood sugar levels. It's always important to discuss potential side effects with your healthcare provider if you're prescribed a new medication. Lastly, age and ethnicity can also influence the risk of developing glucose disorders. The risk increases as we age, and certain ethnic groups, such as African Americans, Hispanics, and Native Americans, have a higher risk of developing glucose disorders. In conclusion, glucose disorders are caused by a complex interplay of genetic, lifestyle, and other medical factors. Understanding the causes helps in prevention and management of these disorders. So remember to stay informed and take steps towards a healthier lifestyle. We've covered a lot of ground on glucose disorders. Let's take a moment to review the main points we've discussed in this insightful journey. Glucose, a crucial energy source for our body, is governed by a complex system that ensures the right balance. When this balance is disrupted, glucose disorders can occur, presenting significant challenges to our health. We've delved into the world of diabetes, a well-known glucose disorder characterized by high blood sugar levels over a prolonged period. We learned about the two primary types, type 1 and type 2 diabetes, each with their unique causes and symptoms. Type 1 is an autoimmune condition where the body destroys its insulin-producing cells, while type 2 is often lifestyle-related, resulting from the body's resistance to insulin. Next, we explored hypoglycemia, the opposite end of the spectrum. This glucose disorder is marked by abnormally low blood sugar levels, often resulting from too much insulin or not enough food. Symptoms can range from mild, like feeling shaky or hungry, to severe, such as seizures or unconsciousness. We also tackled other less-known but equally significant glucose disorders like gestational diabetes, which occurs during pregnancy, and prediabetes, a condition that signals a high risk of developing type 2 diabetes in the future. Moving on to the root causes of these disorders, we learned that they are often multifactorial. Genetic predisposition, lifestyle choices, and certain health conditions can all play a role in their development. For instance, obesity, lack of physical activity, and a diet high in processed foods are significant risk factors for developing type 2 diabetes. Understanding these disorders is not just about knowing their names and symptoms. It's about recognizing the underlying causes and triggers, being aware of the potential complications, and above all, understanding the importance of maintaining a healthy lifestyle to prevent or manage these conditions. Armed with this knowledge, we can better understand and manage glucose disorders. So, let's continue to learn, grow, and take control of our health. Remember, knowledge is power, and in this case, it's the power to ensure our bodies function at their best. Glucose disorders, while complex, are an integral part of medical studies and practice. The layers of understanding these conditions continue to unfold as we delve deeper into the world of health and medicine. Don't stop at this video. Keep the momentum going. Dive into comprehensive texts, explore reliable online resources, engage in forums, and participate in interactive discussions. The more you learn, the more you'll be equipped to contribute to this field. Remember, understanding is the first step to managing and preventing glucose disorders. Stay curious and keep learning.